Hi friends, good evening. Once again, welcome back to my channel Umbilical Nursing. Friends, here we are discussing questions for ESIC exam preparation. We can see today's question. First question, which of the following is correct regarding umbilical cord? And our options, option A, umbilical veins carry deoxygenated blood from placenta to fetus. Option B, umbilical cord has Wharton's jelly. Option C, umbilical cord has one arteries and two veins. And option D, all of this. Our question is which statement or which option is correct regarding umbilical cord. Umbilical cord, we know the other name of umbilical cord is funis and its length is about 50 centimeter. This is the important point. The other name is funis and length of umbilical cord is 50 centimeter. And the umbilical cord has two arteries and one vein, but in our option C, umbilical cord has one artery and two veins, so it is wrong. Umbilical cord has two arteries and one vein. Also this umbilical arteries which carry deoxygenated blood and umbilical vein which carry oxygenated blood. So the function of umbilical arteries is the deoxygenated blood leaves the body, fetal body by the way of umbilical artery and it reaches the placenta. From the placenta, pure blood or oxygenated blood goes to the fetus body by umbilical vein. So here correct answer will come option B. Umbilical cord has Wharton's jelly. This Wharton's jelly helps to protect. Its function is to protect the umbilical vessels. Also, this umbilical cord covers epithelium, then blood vessels, and a remnant of umbilical vessels and vitelline duct. It's all the structure of or coverings of the umbilical cord. So, correct answer is option B. Umbilical cord has Wharton's jelly. And the next question, first line drugs to treat postmenopausal osteoporosis is options. Option A, alendronate. Option B, estrogen. Option C, raloxifene. Option D, thyroxine. Our question is, which is the first line or primary drug to treat postmenopausal osteoporosis? And the correct answer is, it is alendronate. Option A is the correct answer. The alendronate drug which will come under biphosphonate category. This biphosphonate is the first line drug for postmenopausal osteoporosis. Example for this biphosphonate is alendronate, pamidronate or the examples. Okay, here alendronate is there, so that is the correct answer, option A. Move on to the next question. In near vision, what is the changes? Options. Option A, power of lens decreases. Option B, depth of focus increases. Option C, lateral rectal contraction. Option D, sonular tension increases. Our question is, what is the change occurs in near vision? Near vision means the person can able to see only near object. So the main changes occurs in near vision is the depth of focus. We are focusing particular object, that will increase. Okay, so the person can able to see only near object, that is near vision. In that case, the depth of focus or depth of seeing particular object, depth of focus will increase. Move on to the next question. Organism responsible for pneumonia in AIDS patient is options. Option A, cytomegalovirus. Option B, fungus. Option C, pneumocystis carinii. Option D, mycoplasma. Our question is, which organism is cause pneumonia in AIDS patient or HIV positive patient? And the correct answer is, it is pneumocystis carinii. Option C is the correct answer. Move on to the next question. Appropriate size of rectal tube for giving enema for infant is options. Option A, number 16. Option B, number 12. Option C, number 8. Option D, number 14. Question is, which size of rectal tube is used for giving enema in case of infant? So here we have to know the various size of rectal tube, then we can answer this question easily. We can see the size of rectal tube in different age group. For infant, the size of rectal tube is 10 to 12 French. For toddler, it is 14 to 16 French. And for school age, 16 to 18 French. And for adult, it is 22 to 30 French. In our question, infant rectal tube size, it is 10 to 12 French. In our option, 12 is there. So that is the correct answer. Option B, 12 French. The next question is, the enema given to induce peristalsis is options. Option A, astringent enema. Option B, cold enema. Option C, purgative enema. Option D, anesthetic enema. Question is, which type of enema is given to produce or to induce peristalsis? And the correct answer is, it is option C, purgative enema. This purgative enema mainly helps to stimulate peristalsis and helps to cause evacuation of intestinal content or evacuation of the bowel. Okay, so the correct answer is option C. And first option, astringent enema, it is given to relieve inflammation, that is astringent enema. And second option, cold enema, it is mainly given to decrease elevated body temperature. In case of pyrexia and all, this cold enema will help to reduce the body temperature. And last option, anesthetic enema, which is given to induce anesthesia. Okay, so astringent enema, cold enema, purgative enema and anesthetic enema. Here our correct answer is purgative enema, which will help to induce peristalsis. Move on to the next question. For giving enema in adults, the amount of solution should be options. Option A, 500 to 1000 ml. Option B, 250 to 500 ml. Option C, 250 ml. Option D, 100 to 250 ml. Our question is, how much amount of solution is used for giving enema in adults? For adult, the amount of enema solution is 500 to 1000 ml. For children, it is 250 to 500 ml. For infant, it is 250 ml or less than 250 ml. Okay. Usually up to 18 months. Okay. 1.5 year, 50 to 200 ml is giving. So here our question answer is 500 to 1000 ml for adults. Okay, option A is the correct answer. Move on to the next question. Term pyuria means options. Option A, dark colored stool with blood. Option B, painful urine. Option C, pus in urine. Option D, sugar in urine. Our question is, what is the meaning of, what is the term pyuria means what? Okay, so first option, dark colored stool, it is related to stool, so that will not come correct answer. And remaining option, painful urine, pus in urine, sugar in urine, all related to urine. So in that, correct answer is option C, pus in urine. Pyuria means pus in the urine. And option B, painful urination means dysuria. And option D, sugar in urine means glycosuria. Pus in urine means pyuria. And first option, dark colored stool with blood. Blood tinged stool means it is known as melena. And the next question, the enema given to relieve gaseous distension is options. Option A, cold enema. Option B, antihelminthic enema. Option C, carminative enema. Option D, purgative enema. Our question is, which type of enema is given to relieve or to reduce abdominal or gaseous distension? Correct answer is, it is carminative enema. Option C is the correct answer. Carminative enema helps to relieve gaseous distension of the abdomen and thereby causing peristalsis and expulsion of flatus and fetus. Okay, and first option, cold enema, as we already discussed in the previous question, it is given to reduce body temperature in case of pyrexia. And second option, antihelminthic enema, this is mainly given to destroy and expel the worms from the intestine. Okay, so that is antihelminthic enema. And next is carminative enema, that is our answer. And purgative enema also we discussed in the previous question. It is mainly given to increase the peristalsis movement. Next question, a nurse is monitoring a client in labor. The nurse suspect umbilical cord compression if which of the following is noted on the external monitor tracing during a contraction. Here our question is, a nurse is monitoring a client or a pregnant lady during labor. Okay, through how she is monitoring is through external monitor tracing. Okay, external fetal monitoring is Doppler ultrasonic transducer. Through that the nurse is monitoring the client, okay, a pregnant woman. And which among the following finding indicate there is a cord compression? Among our option, variability is there, acceleration is there, early deceleration and variable deceleration is there. Among this option, which indicate umbilical cord compression? So our first option is variability. Variability means fluctuation in baseline fetal heart rate. Fluctuation means it is moving up and down. Okay. So normal fetal heart rate is 120 to 160 beats per minute. The fetal heart rate is fluctuating. It is going up or going down. That is known as variability. So it will not cause cord compression. And second option, acceleration. It means there is temporary increase in fetal heart rate of at least 15 beats or more than baseline. That means from the baseline, that is 120 to 160 is the normal fetal heart rate. From that there is increase. Accelerating means increasing fetal heart rate about 15 beats. Okay, that is known as acceleration. That also will not cause cord compression. And next option, early deceleration and variable deceleration. These two are types of deceleration. Deceleration means decreasing or reducing the fetal heart rate. Here we can see the patterns of deceleration. First one is early deceleration. Early deceleration caused by head compression. Fetal head compression means there is early deceleration. And second one, late deceleration. It caused by uteroplacental insufficiency. Okay, that indicate late deceleration. And variable deceleration caused by cord compression. Okay, so here our answer will come option D, variable deceleration. So here the nurse suspect that there is umbilical cord compression is there because of variable deceleration. On to the next question. Which is the most common cancer associated with AIDS? Options. Option A, leukemia. Option B, adenocarcinoma. Option C, Kaposi sarcoma. Option D, osteosarcoma. Question is, which type of cancer is most commonly seen in AIDS patient or HIV positive patient? And the correct answer is, it is Kaposi sarcoma. Option C is the correct answer. And the next question, while providing oral care to retropositive patient, nurse should. Options. Option A, use special mouth care solutions. Option B, use soft toothbrush. Option C, isolate the client. Option D, wear gloves. Our question is, while giving oral care to retropositive patient or HIV positive patient or AIDS patient as a nurse, what we should do? So in our option D will come correct. Wear gloves, because we are touching the patient. We are giving oral care or mouth care to the patient. Once the patient is unconscious or patient unable to do by himself or herself, then we are giving mouth care to patient. So while providing oral care or mouth care as a nurse, we should wear gloves. And the next question, while taking temperature of HIV positive patient, nurse should. In the previous question, while giving oral care to retropositive patient. Here, while taking temperature to retropositive patient, what we should do? Options. Option A, use 1% hypochlorite solution. Option B, use mask and gloves. Option C, isolate the client. Option D, wash hands before and after the procedure. In this question, we are taking temperature to HIV positive patient. So we are not directly going and touching the patient body or patient body fluids under. So what we should do? Wash hands before and after the procedure. Option D is the correct answer. And the next question, Fertilization occurs in which part of the fallopian tube? Options: option A ambula, option B isthmus, option C interstitial parts, option D infundibular part. Question is, in which part of the fallopian tube fertilization occurs? Fertilization means is the process of fusion of spermatozoa with mature ovum. It takes place in the ambula of the fallopian tube. Option A is the correct answer. Fallopian tube is also known as uterine tube and its length is about 10 to 12 centimeter. Usually it is 10 centimeter in length and it has 4 parts. They are intramural or interstitial part, isthmus, ambula and infundibulum. Here fertilization occurs in the ambula of the fallopian tube. And the next question, grey baby syndrome is caused by options. Option A chlorpromazine, option B chloramphenicol, option C phenytoin, option D gentamicin. Which among the following drug cause grey baby syndrome? And the correct answer is, it is chloramphenicol. Option B is the correct answer. Friends, today we discussed previous year questions, also most important questions for exam preparation. Surely these questions and important points will helpful for your studies. If it is useful for your studies, please subscribe my channel and share my videos to your friend circle.